Introducing Pediatric Oncology Nursing. The first pediatric cancer ward was opened in Memorial Sloan Kettering Cancer Center in 1939. St. Jude's Children's Research Hospital was the first facility devoted exclusively to pediatric tumors. The establishment of the Children's Cancer Group and the Pediatric Oncology Group through the National Cancer Institute in 1955 led to rapid development in the treatment of childhood cancers. With cancer was usually of short duration and focused on helping the child and the family to face inevitable death. In the 1970s, the advent of combination therapies brought about specialized care for patients with differing needs and increased survival of children with cancer. Pediatric oncology is the branch of medicine that deals with the prevention, diagnosis, and treatment of cancer in children. Pediatric oncology nurses perform a wide variety of procedures in both inpatient and outpatient settings. Additional responsibilities including educating families about their child's condition, treatment, and how they can cope with side effects at home. Oncology nurses may also provide information on diet restrictions and ways to prevent infections. Important traits of pediatric oncology nurses: having great communication skills, to be able to connect with them and their families, empathy towards cancer patients and their families, compassion, that's physical and emotional endurance, being patient, ability to maintain emotional stability, being responsible, strong interpersonal skills with all types of children, cautious in excellent attention to details, being considerate, respect for everyone affected by cancer, flexibility, to adapt quickly to changing circumstances, and quick problem-solving skills.
Pediatric oncology nurses care for children, not only for their chemotherapy sessions, but also for the treatment of complications and side effects such as infections, stomatitis, transfusions, and blood count checks. They complete assessments on children prior to having chemo administered to make sure a child is healthy enough to tolerate the treatment. During treatments, nurses perform routine assessments to monitor the child for side effects, including life-threatening reactions. The salary for pediatric oncology nurses in the U.S. is $107,167. Pediatric oncology nurses must make it their job to stay educated about treatment protocols and to stay organized when it comes to their patients. On a daily basis, nurses will have to deal with patients that require surgery, radiation, or chemotherapy, while recovering patients may have physical therapy or other treatments to help aid recovery. While nurses will not lead children in physical therapy, the responsibility to make sure that the patient's various appointments and treatments are scheduled and organized may fall on them.
Pediatric oncology nurses collaborate with patients and their families, medical doctors, respiratory therapists, psychologists and psychiatrists, and other nurses. During a shift, a nurse will provide care and support to cancer fighters and bone marrow transplant children, and support to families upon the new diagnosis of cancer, and provide education about treatments. The average length of stay per hospital visit for pediatric oncology patients is 6.4 days, but that one stay costs approximately $17,000 compared to non-cancer hospital stays of $8,000. Discussions about end-of-life care are seen as abandoning hope because there's such a great expectancy that children will recover. A child's death is so much harder to handle than an adult's because it is much more rare and unnatural. However, children need to participate in these discussions about end-of-life care to the fullest extent possible, because they too have grief and goodbyes. An inadequate professional training in the ethical, moral, and legal implications, including children in their own care, has the potential to rob children of their autonomy and to violate the concept of truth-telling in medicine.
The emotional impact on nurses is something that greatly needs to be considered. Most nurses throughout their career will experience insomnia, emotional detachment, dissatisfaction with work, and flashbacks of traumatic events. They have begun developing critical incident stress management teams that help nurses deal with the feelings of guilt, anxiety, depression, anger, inappropriate emotional responses, feelings of being overwhelmed, and thoughts of suicide and/or homicide. It is often hard to be non-emotional and maintain a strictly professional appearance when dealing with people with life-threatening issues. But for every emotional cost, there is also a benefit. One nurse said that there is so much gratification in nursing when you are able to help a patient turn a corner or comfort someone, and especially when you get a smile or thank you in return. That's what keeps us going. The top 5 most common types of continuing education certifications for nurses are AIDS Certification Registered Nurse, Certified Pediatric Nurse, Oncology Certified Nurse, Family Nurse Practitioner, and Certified Registered Nurse Anesthetist. Some of the main benefits of being a nurse are having great job security, with an expected growth of 15% from 2012 to 2026, better job opportunities, varying job areas such as hospitals, clinics or offices, home health, or teaching, flexible work schedules, career flexibility, high salary packages, mental satisfaction, fringe benefits such as paid holidays, sick leaves, and paid time off, retirement, in some cases tuition reimbursement, dental and vision insurance, health insurance, maternity leaves, lifelong learning, and being a part of a trusted profession. Some of the most common difficulties and downsides of being a nurse are the physical demands, mainly in hospital settings, where foot and back injuries are very common. Long hours, virus exposure, stress and pressure, where nurses don't get much downtime, but are still required to think critically and maintain their composure when working in difficult situations, and emotional burnout. And it's very important for nurses to be able to have a support group around them and be able to have access to great counseling in order to prevent this.